As part of our continuing series with frontline healthcare workers, William Brangham spoke today with Maria Lobaferro. She's a nurse working at a VA hospital in Brooklyn, New York, that has been converted to care only for coronavirus patients. There's already been more than 30 related deaths there. Lobaferro is a member of National Nurses United. It is the largest union for registered nurses in the country. As you will hear, she says her job often comes with too little protection and support.
So, every day is different. I've worked on a weekend where we were reusing the same gown from nurse to nurse, the same protective gown. So when my shift finished, I had to pass that gown on to the next nurse. And then the next day I came back to work and we had gowns. So it's really been very touch and go. As far as staffing, I think that was one of the major issues that we had in the hospital, especially in the ICU. We just tripled our capacity overnight. So there was definitely weeks, I would say all of last month, where the ICU was really struggling. One nurse with 5 critical patients on ventilators. And that's a ratio that's really unheard of.
What's the ratio normally?
So the only state that has an actual ratio is California, and they have a 1-to-1. And they have laws protecting that ratio.
1-to-1, one nurse per...
to one patient.
And you guys are at 5-to-1.
Yes. So pre-COVID, generally it was 2 patients to 1 nurse. These patients are so much sicker than the average ICU patient. And now a nurse is dealing with 5 patients. So at times, most of the time, it was really just unbearable. It was really to the point where a few of us had to actually put our foot down and refuse a 6th patient. So it has been a struggle. As far as PPE, protective covering, and protective gear, it's lacking on the CDC level. If you do a simple Google image search, Italy PPE, China PPE, and then look up USA PPE, you don't need to be a nurse or a doctor or a medical professional to tell that our country is lacking seriously. In other countries, if you look at the healthcare infection rate, it's significantly lower than what the US is at right now. And why is that? Other countries are in a full-on astronaut suit where they don't have any part of their skin exposed. But yet, for the US, we're just in a little thin paper gown. And sometimes you're reusing that gown. How many more medical professionals need to get sick or even die for them to realize that? But it's a serious problem.
That's got to be incredibly frustrating because here you are doing this life-saving work, really, and the country is tasking you with helping stamp out this pandemic, and yet you obviously feel like we don't have your back in some substantive way.
Yeah, prior to this, we dealt with patients with infectious diseases all the time, tuberculosis, and, the things that we're doing today, if we did them then, we would be seriously reprimanded. And it's very discouraging because I'm going into the room, not the head of the CDC. They're at home. And, it's my skin that's exposed, not their skin. So it's been overwhelming, to say the least, I guess.
When you see all of the support, when people are clapping, when there's a shift change or people posting signs, what do you make of all of that support?
I'm very conflicted on that topic. So part of me feels, so proud that my city is supportive. So I'm really overwhelmed by the support of the public. On the other hand, I'm just doing my job every day, a job that I've always done. An ICU nurse, you don't go into the field expecting to not see death. It's expected. But I think the amount that I've been seeing lately has been overwhelming, combined with just the public, you're a hero, you're a superwoman. It just really sets I guess, an unrealistic expectation of how I can perform at work. The other day,
Because you're not bulletproof.
exactly, and I'm not a superhero. And if I was a superhero, I wouldn't have to make decisions every day. Whose bedside do I stand at? Do I stand at the patient who has a heart rate of 20 right now and is probably going to die in the next 10 to 15 minutes? Or do I go to my other patient who's, went to the bathroom on themselves and unfortunately has been in that for 2 hours now because I've just been so busy? So if I was a superhero, I wouldn't have to make these decisions every day. I couldn't feel as further from a superhero as I feel sometimes.
Well, maybe not a superhero, but you feel pretty close to one to me. Thank you.
Thank you. Thank you so much.
Maria Lobafaro, thank you very, very much for your time, and thank you
Thank
for all the
you.
work that you're doing.
Oh, thank you so much. And I hope you stay safe, and you and your family as well.
You too.
Thank you.